Now we're going to show you how to put the tubing on the pump at the beginning. We come over and we turn system on, allow the pump a little bit of time to perform some self-checks. Then we hang our bag and answer a couple of questions. New patient? You're probably not the one initializing the pump on a patient's admission, so we will answer no in a minute. You clip the white and blue segment in there. It'll only go one way. You lift the tubing up and let it settle down into its little saddle. Now that we're on the pump wants to regulate, so we open all the clamps completely open. That's always the principle with pumps. Now we're going to say, new patient, no. And we're going to say, is it a PEDS profile? Yes, because that has certain safety limitations built in. For example, it won't let us run anything at 300 milliliters an hour. That would be too much for a pediatric patient. All of our tubing is going through this particular module, which is labeled B. So we punch channel select and come over here and we punch basic infusion, because this is just regular old plain IV fluid. It's not TPN or it's not a heparin infusion. So basic infusion is what we're looking for. It's going to ask us now to select a rate and a volume to be infused. You use the little arrow keys slightly off to the left of the screen, and this child has an order for the IVs to run at 20 milliliters an hour. The volume to be infused that we select is based on how much fluid is in the bag. This is a new bag that we brought in and hung, so we're going to dial in 850 in there. We could put 950. What we want is for it to beep before it runs out, and that way we will know to come in and rehang a bag before we get in trouble. And then you punch start.